I have heard that the Ministry of Health has made commitments towards prioritizing women, children and adolescents in this time of COVID-19. Walk with me into the Minister's office to understand more about these commitments. Would you please give me a summary of what these commitments are all about?
Thank you so much, Rejoice. It's also my pleasure to meet you this morning. Indeed, as a government, we are fully committed to prioritize issues to do with women, children, and also adolescents' health. And also considering that over 50% of Malawians includes women, children, but we say the youth. Because children and adolescents, we call them the youth. And indeed, they are over 50% of the population. But also in terms of development, if the country has to develop, we really need to put issues of the women and the youth as a priority. So our government is fully committed to issues dealing with women, children and adolescents. It is a priority to us. And also we are receiving about $12 million US, which in Malawi kwacha, it is over 9 billion kwacha allocated to COVID-19 responses in the 2020 and 2021 national budget. And this is to meet the needs of the women, the children and adolescents. We are talking of maternal health, we are talking of neonatal health, we're talking of family planning issues. These are the real issues which our youth, adolescents, they face on a daily basis. But also we cannot run away from mentioning issues of gender-based violence, though they are covered mainly by the gender ministry, but it is also our issue as well, and we need to provide for those. Furthermore, we will ensure that we continue the recruitment process for getting more nurses, more midwives, because in most of our institutions we have a high vacancy rate. So we need to continue the process. The process of recruitment has already started in most of our institutions, most of our hospitals, through council level, but we are continuing doing that. We also make sure that we ensure that sexual and reproductive health related policies, sexual and reproductive health rights as well. Because our adolescents, the young men and young ladies like yourself, they need to know that they have rights when it comes to sexual and reproductive health. So we are reviewing the processes, the policies to make sure that incorporate issues of emergencies which have come about because of the COVID-19.
Thank you so much, Honorable Minister. I would also like to know how much is this commitment and within what timeline?
In this year's budget, like I said before, the Ministry of Health is getting about 194 billion kwacha, which translates to about 258 million US, and we have a special budget for COVID-19 response, which is around 9 billion kwacha. My ministry will ensure that the issues which you have mentioned to do with women, children and adolescents are prioritized in this budget, especially in the COVID-19 response, because we are aware that most of the youth, maybe they could not get the services. We talk about youth-friendly health services, to make health services more available, more attractive to our youth, considering that most of them, maybe they have a fear of going to the hospital. So we have to bring the services to the youth in the community. So these are the areas which we are going to prioritize.
Okay, Honorable Minister. I would like to know what key policies are part of the commitments.
We are committing to complete the sexual, reproductive health and rights strategy, and also the youth-friendly health services strategy. We are also working to complete the National Reproductive Health Service Delivery Guidelines. As you are aware, these strategies focus mainly on the women, children and adolescents. What is special this time is that we are going to incorporate response, like I said, dealing with the COVID-19 pandemic, which is still with us, and indeed maybe we have to have a strategy of living with it, because we have seen outside there that it's not going to go away pretty soon. So we need to have strategies of how can we live, or how can our women and our youth live under the COVID-19 pandemic.
All right. Honorable Minister, how will these commitments help to address issues of inequity, especially gender inequity, in this time of COVID-19?
Like I said before, that most of our population, it is women and the children and the adolescents, and most of the times these are very vulnerable groups. A lot of things, they face a lot of challenges, they face a lot of issues. So that is why the COVID-19 pandemic, we're ensuring that these groups they receive special attention. Just for example, we had to make sure that family planning services, they have to continue, because everybody else, we all focused so much on COVID-19 pandemic. How can we reduce transmission? How can we protect our people? But as much as we're focusing on the COVID-19, we had to make sure that the other services which are being offered to the women, antenatal issues, they still have to have access to those issues to do with pregnant women, but also our youth. We still had to make sure that, you know, we have family planning services being offered under the current COVID-19 pandemic. Malawi also has recently adopted the Respectful Maternal Care Charter that outlines the rights of the women and the newborns as they receive reproductive and maternal health services. This is a clear demonstration that my ministry is prioritizing women, children and adolescents, and we will do more even during this COVID-19 pandemic.
Thank you so much, Honorable Minister. How will these commitments help to support the health workforce?
Our President, Dr. Lazarus Chakwera, made a directive that the Ministry of Health should employ 1,380 additional health workers to support the COVID-19 response. You are aware that the pandemic had put so much stress on our workforce, especially those working in hospitals, even in the health centers as well. So that is why, following the directive, we have started the recruitment process, and it is still continuing. Even now, as the numbers are going down, but we have to be alert. In fact, for us, it was an opportunity because we already had gaps in the health sector in terms of human resource. So this was an opportunity, the COVID-19 pandemic, that we can increase our numbers so that we offer quality health care service to our people, especially the women, children and adolescents. In our national budget, we have set aside 47 billion kwacha for personnel to also accommodate more recruitments and indeed also more promotions in order that we motivate our health workers.
Thank you so much, Honorable Minister. Do you think it's possible for me to return in the future to continue our conversation and to follow up on some progress?
Anytime you are welcome here. I'm at your service. We like this kind of interaction because we have to keep the conversation, you know, going. There's always room for improvements.
That's right.
So you are always welcome to the Ministry of Health.
Thank you so much.
Thank you.